Hello, Jocelyn. We just got done doing the history and physical on the feet. Now we're going to do a physical examination. And I'm going to have you go ahead and take your shoes off, and I'm going to take a look, and then I'm going to inspect. Okay? What I'm inspecting for as I look is any swelling, which I don't notice anything. I'm also looking for any deformities, which I don't see either. And nodules. Okay, nothing poking out of here that looks abnormal. And then I'm looking for corns, calluses, which your feet look pretty good. And then I'm also going to, final thing's going to see is the flat, if you have flat foot. I see an arch here, and I see an arch right here. Okay? So the next thing I'm going to do is you're going to do an active range of motion for me. Okay? So I'm going to have you just kind of hang your feet off. Okay? And what I want you to do is flex your toes. Good. Now extend your toes. Okay, perfect. And then I want you to eversion, which is going to lateral movement outward. Perfect. And then inversion, medial lateral movement inward. All right, perfect. Okay, and then the next thing I'm going to do is I'm going to do this in a passive motion. Okay. So what I'm gonna do first is I'm going to evert. So I'm gonna turn out this way and turn out this way. Any pain, any tenderness and all when I do that, I don't feel any you know, crunching noise, any crepitus or anything like that in there. Okay. And then the last thing I'm gonna do is I'm gonna flex your metatarsal. Yeah, we did the invert, okay, as well as evert, and then I'm also gonna do metatarso phalangeal joint. Okay, I'm gonna push down on this. Any pain or anything here? I don't feel any crepitus at all. Hear any crepitus either? Okay, all right. So then the next part is gonna be palpation. Okay, so first thing I'm gonna do is I'm gonna palpate for what's called Morton's neuroma, okay, or interphalangeal neuroma, and that could be caused by any kind of bursa inside the joints, okay, or some kind of mass. All right, so I'm going to push in between here. Is there any tenderness or pain feeling in here? Okay, I don't feel any nodules inside. I'll check here as well. Here and here and here. Okay, good. Now I'm going to palpate the distal interphalangeal joint right here, which is your first joint on your toes right here. Here and here, 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 and here. Next one is your proximal interphalangeal joint, and that's the next joint down on this, okay? So I'm going to be checking here, 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 here. Any pain at all in this joint? And I don't feel any abnormal nodules, any fluid, and there's no tenderness. Okay, then finally I'm going to palpate the metatarsal phalangeal joint. Okay, and that's all the way down here. Okay, I don't feel anything abnormal, okay? Next thing I'm going to do is I'm going to palpate for the origin of plantar fascia, okay? And this is where people can get plantar fasciitis, okay? So a lot of it is the heel bone right here, and right above it is where the plantar fascia is. And so any push on this palpation would cause you any kind of pain, tenderness. Do you have any right there? No. Okay, and then the same thing down here on this side. No? Yeah. Okay. Perfect. Everything seems to normal and in place, and thank you, Jocelyn, for letting me assess you, okay? Thank you.